Imagine waking up every morning with your mouth so dry it feels like sandpaper, your eyes burning as if you've stared into a desert wind, and a strange exhaustion that clings to you no matter how much you rest. For many people, these are not just random symptoms. They're early cries for help from a condition called Sjogren's disease, an autoimmune disorder that silently attacks the body's moisture-producing glands. According to the National Institutes of Health, an estimated 4 million Americans live with Sjogren's disease, yet most remain undiagnosed for years. What makes this illness especially deceptive is that its symptoms often mimic common problems like dehydration, allergies, or stress, making it easy to overlook until significant damage has already occurred. Research published in the Journal of Autoimmunity reveals that untreated Sjogren's can lead to severe complications such as lung disease, nerve damage, and even lymphoma. The tragedy lies in its subtlety. Many sufferers spend years visiting doctors for chronic fatigue, joint pain, or dry eyes, only to be misdiagnosed with depression or fibromyalgia. By the time the true cause is found, the immune system has already been waging a silent war within. Your body whispers before it screams, and in the case of Sjogren's, those whispers could save your life if you listen carefully. So let's uncover the 12 silent warning signs of Sjogren's disease that you should never ignore, because your health may depend on it. 1. Unrelenting dry eyes. Have you ever felt like there's sand in your eyes, even when nothing's there? That persistent dryness isn't just irritation. It could be your body's way of warning you about Sjogren's disease. This autoimmune condition causes the immune system to mistakenly attack the glands that produce tears, leaving your eyes dry, gritty, and painfully sensitive. According to a study by the American Academy of Ophthalmology, AAO, nearly 90% of people with Sjogren's experience chronic eye dryness as one of the earliest symptoms. The reduced tear production doesn't just cause discomfort, it can damage the cornea, blur your vision, and increase your risk of infection. Over time, this leads to scarring or even long-term vision problems if ignored. You might notice your eyes feel worse in air-conditioned rooms, during long screen time, or while reading. Many people assume it's due to allergies or fatigue, but artificial tears and eye drops may not provide lasting relief if Sjogren's is the cause. That's because the issue isn't surface dryness, it's a deeper autoimmune dysfunction. Research in the British Journal of Ophthalmology also found that inflammation in the tear glands begins long before visible symptoms appear. Early testing, such as a Schirmer's test, which measures tear production, can detect these changes before permanent damage sets in. Your eyes are windows to your health. When they start to dry out, your immune system may already be sending a desperate message. Don't let this silent sign go unnoticed. 2. Dry mouth and difficulty swallowing. Imagine drinking glass after glass of water but never feeling satisfied. That unquenchable thirst and sticky, cotton-like feeling in your mouth are hallmark signs of Sjogren's disease. The immune system targets the salivary glands, reducing saliva production and creating a chronic dryness that makes speaking, eating, and even smiling uncomfortable. Research from the National Institute of Dental and Craniofacial Research, NIDCR, reveals that nearly 80% of people with Sjogren's develop significant oral dryness. This isn't just inconvenient, it can lead to serious oral health problems. Without adequate saliva, your mouth loses its natural defense against bacteria, increasing the risk of cavities, gum disease, and fungal infections like oral thrush. People often ignore this sign, blaming dehydration or medication side effects. But with Sjogren's, the dryness persists even after increasing water intake or changing prescriptions. You might also notice cracks at the corners of your mouth, changes in taste, or a constant sore throat. A 2025 study published in Clinical Rheumatology found that patients who recognized early oral dryness were diagnosed faster and had fewer complications compared to those who ignored it. Regular dental checkups can also reveal the early erosion patterns linked to saliva deficiency, giving doctors a critical clue toward diagnosis. When your mouth can't make enough moisture, it's not just thirst, it's a warning. Listen closely, because ignoring it could let Sjogren steal your comfort, one sip at a time. 3. Chronic fatigue and joint pain. You wake up tired, drag through the day, and feel like your body weighs twice as much as it should. That bone-deep exhaustion, often paired with joint pain or stiffness, is another silent warning sign of Sjogren's disease. This fatigue isn't just sleepiness. It's the result of your immune system constantly fighting itself. According to a study in the Journal of Rheumatology, up to 70% of Sjogren's patients report chronic fatigue and muscle or joint discomfort long before diagnosis. The body's immune attack creates widespread inflammation, which drains energy and triggers pain in multiple areas, often resembling fibromyalgia or rheumatoid arthritis. What makes this fatigue unique is that it doesn't improve with rest. Patients describe it as a deep, unrelenting heaviness that affects concentration, mood, and daily function. Joints may swell or ache, especially in the hands, knees, or shoulders, yet blood tests or x-rays might initially appear normal, leading many to think it's just stress or aging. Research from Johns Hopkins Sjogren Center shows that inflammation in the nervous and musculoskeletal systems can disrupt sleep cycles and energy metabolism, intensifying fatigue. Managing inflammation early through medical guidance and lifestyle support can reduce long-term damage. If your body feels like it's constantly running a marathon you never signed up for, it's time to stop ignoring the signs. Fatigue and pain aren't just in your head, they may be your immune system's cry for attention. 4th, swollen salivary glands. Have you ever noticed a painless swelling just below your jaw or in front of your ears? It might seem harmless, but it could be another silent signal of Sjogren's disease. The salivary glands, especially the parotid glands near your cheeks, are often attacked by the immune system, leading to inflammation and visible swelling. According to a study in the Journal of Oral Pathology and Medicine, about 50% of Sjogren's patients develop swollen salivary glands at some point. The swelling can come and go, often triggered by infections, stress, or immune flare-ups. Many people confuse it with mumps, dental problems, or even lymph node swelling, which delays diagnosis. This swelling can cause discomfort, tenderness, and sometimes mild pain while chewing or swallowing. In severe cases, the glands may harden or become chronically enlarged, making the face appear puffy. Doctors often use imaging tests like ultrasound or MRI to detect underlying inflammation or blockages. Research from the Cleveland Clinic also found that persistent gland swelling may indicate more advanced autoimmune activity, sometimes leading to complications such as lymphoma in long-standing cases. That's why paying attention to even subtle gland changes is crucial. If your face seems to swell without reason, don't brush it off as just a reaction. Your body could be signaling that something deeper, something autoimmune, is stirring beneath the surface. 5. Persistent cough and breathing problems. Do you find yourself coughing for no reason or feeling short of breath even when you're not sick? This unexplained discomfort could be linked to Sjogren's disease, as the same immune attack that dries your eyes and mouth can also affect your lungs and airways. According to research from the European Respiratory Journal, around 15 to 30% of Sjogren's patients develop lung involvement. The dryness extends into the respiratory tract, leading to a persistent dry cough, sore throat, or chest tightness. In more advanced cases, inflammation can cause interstitial lung disease, ILD, a condition that scars lung tissue and reduces oxygen exchange. You might think it's allergies or a lingering cold, but unlike typical coughs, this one doesn't go away easily. It can worsen at night or after physical activity. Some patients even describe a burning sensation in the chest, which can mimic asthma. A study by Johns Hopkins Medicine found that early lung screening in Sjogren's patients improved long-term outcomes by preventing irreversible damage. Simple tests like pulmonary function exams and high-resolution CT scans can reveal inflammation before symptoms become severe. If your cough lingers and no medication brings relief, your lungs may be asking for attention. Don't ignore the dryness within. It might be Sjogren's whispering for help from deep inside. 6. Vaginal dryness in women. One of the most overlooked and emotionally challenging symptoms of Sjogren's disease is vaginal dryness. Though rarely discussed openly, this symptom affects a significant number of women with Sjogren's, impacting intimacy, comfort, and overall quality of life. According to a study published in Rheumatology International, nearly 60% of women with Sjogren's report vaginal dryness, irritation, or discomfort during intercourse. This happens because the same autoimmune process that dries the mouth and eyes also affects the mucous glands in the vaginal tissues. The result is reduced natural lubrication and increased susceptibility to infections or inflammation. Many women mistake these issues for hormonal changes, especially during menopause. However, vaginal dryness caused by Sjogren's can appear even in younger women and may persist regardless of hormone therapy. Researchers from the Johns Hopkins Sjogren Center emphasize the importance of early gynecological evaluation to distinguish autoimmune dryness from age-related changes. Ignoring this symptom not only affects emotional well-being, but also raises infection risks due to the loss of protective moisture barriers. Treatment with topical moisturizers, lubricants, or prescribed hormone therapy can help restore comfort and confidence. When your body's natural balance begins to fade in silence, it's not just a women's issue, it's a health alarm. Speak up, seek help, and remember that acknowledging this dryness isn't weakness, it's strength in protecting your health. 7. Constant sinus infections. Do you keep battling sinus infections even after multiple treatments? Repeated sinus problems could be more than bad luck. They might be a hidden sign of Sjogren's disease. The immune system's attack on moisture-producing glands doesn't stop at the eyes or mouth. It also dries out the nasal passages, leaving them unprotected and prone to infection. Research published in the American Journal of Rhinology and Allergy reveals that nearly 40% of Sjogren's patients experience chronic sinusitis or nasal dryness. The lack of natural mucus weakens the nasal barrier, allowing bacteria and dust to irritate sensitive tissues. This can cause congestion, nosebleeds, or even a persistent post-nasal drip. Patients often believe these recurring infections are caused by allergies or seasonal changes. However, typical sinus remedies provide only temporary relief because the underlying issue, autoimmune dryness, remains untreated. Over time, this constant inflammation can lead to thickened nasal membranes or even loss of smell. A study from Mayo Clinic found that managing moisture levels with nasal saline sprays, humidifiers, and immune therapy significantly reduced infection frequency in Sjogren's patients. Recognizing the autoimmune link early can prevent years of misdiagnosis and discomfort. If your sinuses keep crying for help, it's time to listen. Chronic dryness isn't just irritating, it's your body's quiet signal that something deeper may be draining your defenses. 8. Skin dryness and itching. Does your skin feel tight, rough, or constantly itchy despite using lotions? This uncomfortable dryness might not just be a cosmetic issue. It can be a silent warning sign of Sjogren's disease. The condition reduces oil and sweat production, weakening your skin's natural protective barrier and leaving it vulnerable to irritation. A study in the Journal of the European Academy of Dermatology and Venereology found that more than 50% of Sjogren's patients experience chronic skin dryness or dermatitis. The dryness often appears on the arms, legs, and face, and may come with redness or small rashes. Some people even develop Raynaud's phenomenon, where fingers and toes change color in response to cold due to poor circulation linked with autoimmune activity. Unlike typical dry skin caused by weather or dehydration, Sjogren's related dryness persists even with regular moisturizers. This happens because the glands responsible for producing sebum, the skin's natural oil, are attacked by the immune system. As a result, the skin loses elasticity, becomes flaky, and heals more slowly. According to research from Johns Hopkins Medicine, maintaining skin hydration through gentle, fragrance-free products and omega-3 rich diets can help manage symptoms. Dermatologists also stress the importance of identifying autoimmune-related dryness early to avoid long-term skin damage. Your skin tells your story. It reflects your body's inner health. When it starts cracking without reason, it may be whispering the truth your immune system is trying to hide. 9. Numbness or tingling in hands and feet. Have you ever felt pins and needles in your hands or feet that just won't go away? This sensation, often ignored, could be a nerve-related symptom of Sjogren's disease. The condition can cause peripheral neuropathy, where inflammation damages the nerves responsible for sensation and movement. According to a study in the Journal of Clinical Neurology, about 20 to 30% of people with Sjogren's develop nerve complications. These can manifest as tingling, burning, or numbness in the extremities, and sometimes even muscle weakness. Over time, the nerve damage can affect balance, reflexes, and coordination, making everyday tasks harder to manage. This symptom is often mistaken for diabetes, vitamin deficiency, or circulation issues. However, in Sjogren's, the cause lies in immune cells attacking the nerves directly. Research from the National Institutes of Health, NIH, discovered that nerve inflammation can occur even before other classic symptoms like dry eyes or mouth appear. If left untreated, neuropathy can become permanent, highlighting the importance of early neurological evaluation. Electromyography, EMG, tests or nerve conduction studies can confirm whether Sjogren's is the underlying cause. When your nerves start to whisper through tingling or numbness, don't silence them with assumptions. Listen closely. Those small shocks might be your body's way of shouting for help. 10. Digestive problems. Do you often experience bloating, stomach pain, or unexplained diarrhea? These digestive issues might not just be from food sensitivity. They can be a hidden symptom of Sjogren's disease. The same autoimmune process that dries the eyes and mouth can also affect your digestive system, especially the glands that help produce stomach acids and intestinal lubrication. A study published in the World Journal of Gastroenterology found that over 40% of patients with Sjogren's report chronic digestive symptoms, such as acid reflux, irritable bowel syndrome (IBS), like discomfort and difficulty swallowing. Because saliva plays an important role in digestion, its reduction can lead to poor nutrient breakdown, causing heartburn or discomfort after eating. Moreover, inflammation in the intestinal lining can disrupt the gut microbiome, your body's natural defense system against infection. Researchers at Johns Hopkins Medicine observed that this imbalance can lead to malabsorption, bloating, and even liver complications in severe cases. Some patients also experience a sluggish digestive system due to nerve inflammation, a lesser-known complication of Sjogren's. Many people ignore these symptoms, thinking they're caused by diet or stress, but persistent digestive trouble can indicate deeper autoimmune involvement. Doctors often recommend endoscopy or stool analysis to identify inflammation or bacterial changes linked to Sjogren's. When your gut feels uneasy without a clear reason, it's time to listen closely. Your digestion isn't just about food, it's your body's way of telling you that your immune system may be quietly struggling within. 11. Difficulty concentrating and memory problems. Have you ever walked into a room and forgotten why you went there, or struggled to focus on simple tasks? This mental haze, often described as brain fog, is a surprisingly common yet overlooked symptom of Sjogren's disease. It's not just forgetfulness, it's your brain feeling like it's running through fog. According to a study in the Journal of Clinical and Experimental Neuropsychology, up to 60% of people with Sjogren's experience some degree of cognitive dysfunction. This includes problems with memory, attention, and mental clarity. The cause? Chronic inflammation, poor sleep from fatigue or pain, and reduced blood flow to brain tissues, all byproducts of the autoimmune process. This symptom can be frustrating, especially when others dismiss it as stress or aging. Patients often describe feeling mentally slowed down, making daily work, decision-making, and conversations more difficult. Research also shows that systemic inflammation may interfere with neurotransmitters like serotonin and dopamine, affecting both cognition and mood. Harvard Medical School research indicates that early management of autoimmune inflammation through medication, balanced sleep, and anti-inflammatory diets can improve mental function over time. Simple lifestyle adjustments like mindfulness, rest breaks, and hydration can also make a noticeable difference. When your mind feels clouded and focus slips away, don't just blame it on being tired. It could be your brain's quiet cry for help, urging you to look deeper before the fog thickens. 12. Unexplained fevers and swollen lymph nodes. Have you ever felt mild fevers or noticed tender lumps under your jaw, neck, or armpits? These subtle symptoms could be your immune system's way of sounding an alarm. In Sjogren's disease, chronic inflammation can cause swollen lymph nodes and low-grade fevers as your body fights against itself. A study in the Scandinavian Journal of Rheumatology found that around 30% of patients with Sjogren's experience periodic fever or lymph node swelling. This occurs because the immune system, in a constant state of activation, causes lymphatic tissue to enlarge. While these symptoms may seem minor, they can sometimes signal serious complications, such as infections, or in rare cases, lymphoma, a known risk in long-term Sjogren's patients. The swelling may come and go, often accompanied by fatigue or joint pain. Many people ignore it, assuming it's just a minor infection or seasonal illness. However, research from the Mayo Clinic emphasizes that persistent swelling or unexplained fevers lasting more than 2 weeks should always be evaluated by a doctor. Early screening can rule out dangerous developments and ensure timely care. Your lymph nodes are guardians of your immune system. When they swell without reason, it means your body is fighting an invisible war. Don't dismiss these silent alarms. They could be your body's last whisper before a louder health crisis begins. Sjogren's disease may often act in silence, sending subtle signals through dry eyes, chronic fatigue, digestive issues, and other seemingly minor symptoms. In this video, we uncovered 12 silent warning signs that you should never ignore, because recognizing them early can make a significant difference in your health and quality of life. By paying attention to your body, seeking timely medical advice, and adopting supportive lifestyle habits, you empower yourself to protect your health and live more comfortably. Remember, you are not alone. Millions of people face similar struggles, and even small changes, like staying hydrated, managing inflammation, and monitoring your symptoms, can lead to meaningful improvements. Each step you take is a victory toward better well-being. We'd love to hear from you. Share your experiences, questions, or thoughts in the comments below. Your story might help someone else realize the importance of these warning signs. Thank you so much for spending your valuable time with us today. Take care of yourself, stay aware, and remember, listening to your body is one of the kindest things you can do. Goodbye for now, and we'll see you in the next video.